Good morning, everyone. I think we're going to get started. It's my great honor and privilege to welcome Dr. John Eble. He is currently the chairman and also North Shore Professor of Laboratory Medicine in Department of Pathology and Laboratory Medicine, Indiana University. And Dr. Eble has a long, distinct career, so I have to be brief to introduce him, and so he will have a lot more time to interact with you guys. So he grew up in Indiana and spent a year in college in City University in London, England, and then 3 years in Indiana University. Then he continued his medical education and the pathology resident training in Indiana University and became faculty there in 1980s. And was risen to the rank of full professor in 1991, and then become department chair in 1998. And he has been very active in several professional societies and been serving in the reviewers and editorial members of many international journals. He was the editor-in-chief of Journal of Urological Pathology. Right now, he is the editor-in-chief of Modern Pathology, and which he served since 2000. And under his leadership, and the Modern Pathology have become most read and also highest impact journals in practicing anatomic and molecular pathology. I think recently there's a lot of coverage on molecular pathology. So he has like 275 publications, edited 6 books and 45 book chapters. And he will be the next editor for the AFIP fascicles, a general urinary pathology. I really like the fascicle. It's a really good book for me to read it and to understand the pathology. So today he's going to talk about his experience with modern pathology, and he's going to be serving for almost 20 years. Welcome, Dr. Eble.
Thank you. I've tried to structure this to get through my slides in about a half hour or 40 minutes, so there would be plenty of time for questions, because when I gave this for the first time at University of Toronto, there were a lot of questions. So let's start by considering, what are the elements of a successful submission. Identification of an interesting and important research issue. Not to say that things that are less interesting and less important can't be published, but to achieve best success, you have to start with a good idea. Then you have to design a study properly to answer the questions. It's going to depend on whether it's a clinical study, whether it's possible to have relevant controls, and so on. I mean, study design is going to vary, but it needs to not have major defects. And one of the jobs of the reviewers is going to be to look for such defects. And sad to say, positive results that are novel. One reads a lot today about the medical field not publishing enough negative results. Much of that is related to clinical trials of drugs and not terribly relevant to pathology publication. But positive results, I think, get more praise from reviewers. I've observed that. Sometimes the reviewers say, this is all adequately done, but the results are negative, and so it's not as high a priority. And novelty. In modern pathology, we like to be the first to present new information. And so confirmatory studies are very important too, and sometimes there need to be quite a few of them if you're confirming something unlikely. But they get a little lower priority in modern pathology. Good writing and illustrations. Good writing, one of the challenges I see authors having all the time, frequently, is they're immersed in the work. They understand it very well. They talk with their colleagues in some form of path speak shorthand. They then try to convert it into English sentences. And they don't put themselves in the place of the reader. And so the reviewer, who's much closer to being in the place of the reader, reads through this paragraph and says, I don't understand what this paragraph is saying. So it has to be well done. And then illustrations. Pathology is a very visual field. Most of us who've gone into pathology, and we went in part because we had good visual memories, we liked looking at things, And so the illustrations need to be good. But the most important element of success is inspiring confidence in the reviewers and editors. And I'll go into that in quite a bit more detail. So, what is the journey of a manuscript? Starts with preparation in your office and laboratory, submission to the editorial office, which today is electronic. When I got started, it was all paper. And so the managing editor's main job was to stand in line at the post office and to move things back and forth. Today it's all electronic. That's not necessarily easier. Our managing editor spends a lot of time helping authors navigate the publisher's manuscript management system. So then it comes into the editorial office, and I look it over. My associate editor, Harvey Kramer, looks it over. Sometimes the paper will really not be suitable for modern pathology. We don't publish animal studies. We don't publish studies that rely too heavily on cell culture experiments. And so we will turn those away without even bothering to ask for a reviewer's consideration. But the ones that we are going to send out, we then have to recruit the reviewers. So we send them the abstract and online, and they say yes or no. Most of the reviews are done by editorial board members. In our journal, we currently have about 125 editorial board members. The next step is the review, which seems to the average author interminable. It actually is not as long as it seems. It's a little bit of a remembering the really long ones and forgetting the quick ones kind of human nature thing, but it does happen. And so the reviewers return the review. We usually, on average, have 2 reviewers. Sometimes when there's an unanswered question or a disagreement, I'll recruit a 3rd reviewer. Sometimes when the first reviewer gives to return the review, it says this is hopeless, I can't understand a word these people are writing, or there's been 3 papers in the last 6 months that were better than this on the same subject, then I'll just reject it right away and not, and give the other reviewer a day off. So then there's what we call the initial decision. And the initial decision is also the last decision in the case of rejection, basically. In the case of something that we want to publish, almost always, and by that I would mean 99.9% of the time, further revision will be required. Sometimes this revision is mainly of a kind of a technical nature. People haven't formatted the manuscript right for us or whatever, but a lot of the times there's actual changes that need to be made, additional data to be obtained. Sometimes those data are hard to come by. So we send out the reviewers' comments to the authors and any comments that I might want to make at that stage. So then there's the process back to the author of revision. And the revision, of course, is to make some changes and then to write a letter. And some reviewers will decline to make changes, and they will write a letter saying that they don't want to make changes. And that's a challenging situation at times. Sometimes the reviewers have asked for something that really is very difficult to do. And if its omission is not a big enough obstacle to publish the paper, we will go ahead and publish it. But other times the reviewers seem to be just pig-headed, and then they don't fare so well. And so then there's the final decision, and that's made by me. We get about 900 manuscripts a year, and I am the final decider on every one of them. So I touch 900 manuscripts a year. That means there will be 3 coming in today that I won't get to till tomorrow, kind of a thing on average. The final decision, by and large, is final. There is an appeal process, and that's an important thing, and we certainly intend to maintain that going forward, because every once in a while there are genuine injustices. And when there's been a genuine injustice, or if there's been a reason to be concerned that one of the reviewers had some bias, then we can respond to that usually by getting additional reviewers to look at it and see whether 2 out of 3 agree, then we go that way. But we rely a lot on the reviewers. The reviewers are just critical to the success of the journal. So, manuscript preparation. Select the target journal. That's an important part of the preparation. Should be done before you start doing much writing, because different journals will have different formats. They'll have, but they'll also have sort of different atmospheres, and you'll emphasize one thing rather than another to a greater or lesser extent, depending on the journal, if you know the journal. In this world of electronic information, we get a number of manuscripts from people in faraway places who clearly have never seen an issue of Modern Pathology. They've seen some Modern Pathology articles that they can get online, and maybe in their area of research, but they don't have a good idea of what Modern Pathology is all about. And they don't know who the readers of Modern Pathology are. And this is a kind of a tricky thing today, because Modern Pathology is a society journal. And the great majority of the USCAP members pay for a paper copy of the journal with their dues. It's part of their dues. And so those are readers. And there are pathologists of all kinds of interests, very broad interests, some of them very narrow interests. And then there's the readership that gets it online all around the globe. And that's potentially almost anybody. And so we try to keep, in our own way, in our own imagination, the society member readership. We have some sort of, I'll admit, it's completely fantasy in some ways, but I've been going to USCAP meetings for a long time, and I know a lot of USCAP members, and I have some, I think, gestalt idea. Try to keep them in mind, because we want them to be happy that the journal comes to their office every month, and we want them to be happy that this is a benefit of membership and maintain their membership, and so on. So that's part of the target journal, is knowing the journal in that way. Secondly, this is going to seem very obvious. Read the instructions for authors. It's very obvious, but it's hardly ever done. But it is well worth your while, because then, to be more likely to be successful, you need to write and illustrate following the instructions instead of making it up as you go along. So in considering the target journal, is it within the journal's scope? As I said, Modern Pathology doesn't do animal work. Modern Pathology doesn't do total cell culture studies. We do publish some studies that have a little accessory cell culture work to confirm some point. But know what the scope is. Modern Pathology is not a great name for a journal because it suggests that it could be almost anything. So we get some clinical chemistry papers every once in a while. Well, we don't do clinical chemistry papers. And we're judicious about certain categories of papers that come up that seem to be potential bottomless pits, because we know that if we publish a few papers of this type, then it's like throwing out the welcome mat and we will just be deluged with them. And these are things like methods papers validating some new equipment, methods papers testing different antibodies to, I don't know, PD-L1. Well, I mean, you can do that, and then it's just going to go on, and it'll eat up the whole page budget, and certainly it'll eat up all the time of the reviewers. So we're very judicious about accepting some of these things. And then how are illustrations treated? Early in my career, I published in Journal of Urology, fair amount, because they were very kind to me. But they publish photographs that are about the size of my thumbnail. They're terrible for pathologists. In Modern Pathology, we have tried to show the photographs as large as possible. It's not at all infrequent that some well-meaning author has put together an array of photographs that's 4 across and 2 down. Well, that's the exact opposite. Then they're going to be the smallest possible. If they're 2 across and 4 down, it'll be a page of photographs, and they'll all be twice or 3 times as big. So think about those things, how to get your illustrations treated well. You know, is your paper likely to be accepted? Modern Pathology is a general journal, goes out to a broad audience. And so some, you know, really esoteric stuff in, I don't know, hematopathology is not going to be as interesting to as many of our readers as we would like our average article to be, and it may be better in a journal that's purely for hematologists. I mean, I'm not picking on hematopathology as an example. And then is impact factor important to you? And this is a 3-slide digression on impact factor because even though it's a pretty simple calculation, not everybody has it at the tip of their tongue. So if we have X number of papers published, say, in 2015 and 2016, then in 2017, the number of times those papers are cited is compiled, and then you divide the number of citations by the number of papers. It's a simple fraction. But there are variations on it. You could do it for a 5-year period. There's some other factors that are competing with it, but it's pretty well established. There are about 12,300, actually more accurately 12,304 at the last listing, of journals that actually have impact factors. And to have an impact factor, they've got to be integrated into this data collection system. Only 242 of these have impact factors greater than 10. And that's 2%. And 10 is selected because the NIH has its opinion about what is a high impact factor journal, and that's 10 or that's over 10. So Proceedings of the National Academy of Sciences at 9.87 or whatever it is currently does not qualify. Go figure. How the mighty have fallen, I don't know. Modern Pathology has an impact factor of 6.655, which ranks 483 out of 12,300, which is in the top 4%. Twice, you know, farther down the line as the NIH one.
These are all journals, not.
This is no. This is physics. This is astronomy. It's you'd be digging deep to go down 12,300 in the medical journal field. You'd have to include all those ones that send you emails every day asking you to publish your paper for a small fee. Well, they're hard to count. Medical journals do well for impact factor. In the top 20, about half are journals that reasonably could be considered to be hospitable to medical papers. And the top one, of course, is, and it's been the reigning champion for practically forever, CA, Cancer Journal for Clinicians. And to get down to just the 241st, well, to get down to 243, which is the cut point for impact factor at 10, the lowest medical one is leukemia. And there's a lot in between, obviously, but it's not hard for medical related articles to be accepted. I mean, it is hard, but it's not infrequent for them to be accepted in high impact factor journals. So that's my digression. So moving on to the process, instructions for authors. These are requirements. These are not suggestions, they are instructions. Failure to follow them, beyond making things difficult in production and so on, is taken by some reviewers as evidence of a lack of attention to detail. And then they ask, well, if the authors aren't paying attention to detail in this area, why is it that we should believe them that they're paying attention to detail in anything? Another point about following instructions to authors is do it every time you move the article to a different journal. Because if an article is submitted in the wrong format, an example for Modern Pathology would be we did not divide abstracts into sections with headers. Never have, but a lot of journals do. So if we get one that's there with headers, we think it raises the possibility that it's already been rejected by at least one other journal. This is not the right way to start off. So pay attention to the instructions. So, and that's part of this inspiring confidence, but we'll get to that in a little bit more detail here in a moment. So the abstract should succinctly present the findings and why they're interesting. You oftentimes will have a word limit, so that's the succinct part, but it also needs to stand on its own. And by that I mean it should not be comprehensible only after the paper's been read. It should be comprehensible on its own. And that's, I think, really important. And in the introduction section, you set the stage by explaining why the study was done, but without rehashing what everyone knows. The reason that CA, a cancer journal for clinicians, has an impact factor of 245, and in New England Journal is only 70, is that there are a lot of papers that begin that breast cancer affects so many 100,000 women per year in the United States, and they cite CA, a cancer journal for clinicians. All the readers know that breast cancer is important and affects a lot of patients. It's a sort of ritualistic act to start your introduction with something that everybody already knows. And it doesn't really achieve anything except a great impact factor for that journal. Critically review present knowledge to show what the gap is that you're trying to fill, and briefly state your study plan. Materials and methods, here's where you get into the study plan in more detail. And the study plan really must make sense. I read a lot of papers about kidney tumors, and so somebody will have a kidney tumor of interest, and they'll have 10 cases of those, and then they'll have 30 controls of clear cell, and they'll have 15 controls of papillary. There's no statistical justification for how many examples you're spending money to analyze in each of these compartments. It's just what they have, oftentimes what they have on a tissue microarray slide. But it doesn't make sense. It's not logical. And that kind of problem can crop up a lot of places. And then divide the materials and methods into sections according to the sort of the processes, where you got the material, what you did to it. And that just makes it easier for the reader to understand. And all along, put yourself in the place of the reader. Your job as an author is to make life easy for the reader. And you may feel like your job is getting promoted or something, but that's true too. But it'll go a lot better if you make life easy for the reader. Statistical methods should be appropriate. I get a number of, we get a number of papers from anatomic pathologists who don't really understand that predictive value, for example, it's an integral part of that calculation is having some information about the population as a whole. Taking a set of this kind of tumor and another set of this other kind of tumor, you can't really get to predictive value. And when you're studying rare things, you've got very big problems because you don't need very many false positives in the common thing for a positive to be far more likely to be a false positive than a true positive. And that's just a simple example. So statistical methods must be appropriate and make sense. Study population must be sufficient. There's not enough power calculation. A lot of reviewers send in reviews every month saying, well, this is all interesting, but it's way underpowered to achieve a conclusion. Or maybe looking at too many variables with too few specimens. And controls must be appropriate. A lot of times controls are not even included in anatomic pathology work. The results. Present the data in a form that enables the reader to check the work and to reproduce it if they have materials available to them to do so. There should be enough data and information in the materials and methods and the results to be able to redo the work. One trend that I've seen repeatedly recently is there's a sort of a rush to as we're looking, as people are studying something new, a new entity, if you will, there is a kind of a rush. So the first paper gives plenty of detailed data about the patients and their tumor or whatever. And then the second paper does that, and by the time there's a third paper, even though there's only been 30 described, the results become derivative. They're averages, ranges, but the individual case data are not presented. And of course, then the person who comes later has real trouble using the third paper to combine with the first and second papers to do any kind of meta-analysis. The other thing that's a little bit irritating about this rush to aggregate is it's a sort of arrogant, because there's a presumption that the authors have thought of all the possible questions to ask out of the data set. And so nobody's going to come along with a new idea and say, well, let's test it in this data set, kind of a thing. So I think presenting real data as much as possible is there, and it is very important, and it's part of the mission of the journal. And it's also today, it's in some ways easier because we do have electronic supplemental files. Now, those are getting used a lot of different ways. There's not a general consensus on how to use those, but at least it's something that we can evolve toward using better. Then we get to the discussion. Judiciously interpret your findings in the context of previous knowledge. One thing that really irritates reviewers is people overselling what they've done. Presenting conclusions that are not supported by the data, overstating the importance. Here's a good example from my world, kidney tumors. There's a tendency today when doing genetic analyses of kidney tumors for authors to say, tailored therapy is really important in kidney tumors, individually tailored therapy. This is not true. 80%, 90% of clear cell renal cell carcinomas today are treated, are cured by surgery, and they're all treated by surgery. So it's important for the minority who have advanced stage disease, but that's not the way they put it, because then they've reduced their claim by saying it's about the minority instead of about everybody. And so overselling is really irritating to reviewers, and they let me know. Show that you understand the results of the statistical analysis. Honestly assess potential sources of bias and other weaknesses. At least it shows that you've been thinking about it. You haven't been able to fix it because of the reasons you explain and your honest assessment. And then honestly estimate the implications of your findings. You know, reference list. It's there for every journal I know. There is an attestation that all of the increasingly numerous authors have read and approved the manuscript. And yet I see reference lists with such egregious errors in them that I cannot believe that any of the authors reviewed the reference list. That's a problem, because you're not inspiring confidence at that point. What you're inspiring is mistrust. Citing relevant papers, omitting relevant papers is a problem, because that could be self-serving, trying to make your paper look more novel than it really is. And the reviewers are experts and they'll catch you at it. Citing irrelevant papers published by yourselves to puff up your citation rate is also easily detected and not approved. Not proofread, so I said that. Illustrations. One of the things that illustrations do is prove that your diagnosis is correct. When a reviewer tells me that the illustration, in their opinion, does not illustrate the entity that is being studied, that is a fatal flaw that cannot be corrected. There's no resolution for that, because we've lost confidence that the pathologists writing the paper don't make their diagnoses the same way that the expert reviewers make them. There's no way to fix that. Show what you interpreted as positive. A lot of things are subjective to some extent, so at least show what to you is a positive result, and sometimes what a negative one is. As I said before, the quality really needs to be excellent. Composites, modern pathology charges a fee for excessive numbers of pages of color. And so we have authors who are trying to squeeze into one page 20 photomicrographs, 3 immunofluorescent photos, a couple of heat maps, and it all gets smaller and smaller and smaller. And that's a big problem because it just, I write sometimes, the way you've got your illustrations, when they appear in print, they'll be too small to be useful, interpretable. And what's the point at that time? You know, it's just sort of abstract colors. So there are some common misconceptions. One that's shockingly common is that the manuscript as originally submitted is a sort of rough draft. No, we view it as the author's best work, most polished, the best they can do. We do not consider it as a chance to have another draft. Another misconception, the editorial office or publisher can repair problems with English language usage. The editorial office is me and Harvey in Indianapolis with our computers, Catherine Ketchum and Martha elsewhere with their computers, and that's it. People who imagine a legion of English majors with sharply pointed pencils ready to fix things up are wrong. We do a thing called copy editing, which is the publisher's purview, and they outsource it. A few years ago it was outsourced to India, and I'm not sure where it probably still is. But these are people who have a 1 or 2 page list of things to look for and fix. Punctuation in the reference list, stuff like that. They're not going to rebuild sentences that need new carburetors. Reviewers, who are the reviewers? Well, they're busy experts who are volunteers. And we have to use them judiciously because many of them are reviewers for a number of journals that they're on the editorial boards of. And so they're going to get the work done and they'll do a good job, but it takes time, and this isn't the first thing to do on their daily priority list. But on the upside, they're people who usually have interests in common with the authors. And this is really important because the authors are likely to start off on a good footing with these reviewers because they have common interests. And they're likely to understand what the authors are trying to say better than a general pathologist or a pathologist who's expert in something else. So they're more likely to kind of understand the shorthand a little bit. They're on the lookout for it. But the thing about the maintaining confidence is that reviewers and editors have many things that they have to accept on faith from authors. We cannot go in and check the lab notebooks. We cannot ask for the slides and look at them under the microscope. We have to take a lot of that on confidence. That's why when an illustration is said to represent one thing and the reviewer says, no, there's no way that's a critical loss of confidence. When things appear to be done in a sloppy way, lack of attention to detail, over all of these things I've been talking about, they all erode confidence. And it's very hard to get confidence back. So when the reviewers report to me, they have a set of comments for the authors, and they have the opportunity to make private comments to me. And then we have a number of questions that are yes/no questions. Reviewers hate this, many of them, but it is actually helpful to me. So what is your overall recommendation? What is your estimate of priority for the paper? That's a way of starting to get at, is this going to fit into the 15–18% of papers that we receive that we can actually publish? Are the study and results novel? Are the conclusions supported, and so on? And that's a way to, I instituted these questions because the narratives that they give don't always touch on all these subjects, and this is a way to get the reviewers to make some contribution of opinion on each of these very important subjects. So review is, as I have said, a subjective process, and most of the reviewers start out wanting to feel positive about the paper in hand. So that's why it's important to avoid irritating the reviewers. So a common misconception, another common misconception, is that the reviewers have a mission to help improve manuscripts which will not be accepted by the journal. No, my instructions to the reviewers is spend as little time as you can get away with on ones we're not going to publish, to reserve your time to help improve the ones that we will publish. And we'll take things through second review, and rarely a third review, try to polish and improve the ones that are the best. Having multiple reviews doesn't necessarily mean that the paper's not good. It means that we like it enough that we're willing to go to a lot of extra work to improve it. Another common misconception: the reviewers are brutally frank in their comments to the authors. No, no, no. Our reviewers are gentle people. They're raised by their mothers and fathers to be polite and to be courteous and to be considerate. Brutal frankness comes in their comments to me. I couldn't finish reading this. The English is atrocious. They're never going to say that to the author. And so that's just a fact of life. Would it be better if they were maybe more candid? Another common misconception is the default setting is that the paper is acceptable. And this kind of gets into the appeal process. We get a lot of appeals of rejections where the authors say, well, I can fix this, this, and this that are the comments of the reviewers, and then it should be acceptable. That's just not true, because we operate under a strict page budget. The cost of producing a journal is related to the cost of setting out the page design, to the cost of printing, paper, ink, machinery, cost of shipping, by weight, cost of the editorial office, and there's a budget for that that's worked out between USCAP and Springer Nature every year. And even if all of the 900 papers were Nobel Prize contenders, we would still only be able to publish up to our budget. And so being rejected doesn't mean that it's not a good paper. It means that we've considered our idea about priority, which includes what we think the interests of the member readership is, and other things. So that's something that people don't really understand. I think they think that we can just add more pages willy-nilly, and it's just not true. Time from acceptance to publication is going pretty well for us these days. This is a situation where the electronic transfer to the production office at the publisher, and the production and electronic publication ahead of print, so we can actually get things on the record much earlier than we could before. That I think is really working quite well, and it's a big advance. And the electronic transmission to the printer is pretty good. So in the initial decision, as I said, this is sort of saying the same thing. My job as the editor in the initial decision is to weigh what the reviewers say, look at the overall topic and what the paper's doing, and try to identify the top 15 to 18% of articles. And what does the editor want in doing this? Reader happiness, because the Academy wants to keep members. We want to attract more outstanding papers, and so we've found that good begets better over time. And keep my job, not make too many people too unhappy. But a big part of being an editor of a selective journal like this is 80+% of the time I'm sending bad news. And being a surgical pathologist and sending bad news in reports, I'm used to sending bad news. But if it hurts a person who is, is unhappy over having to send too much bad news, is not going to be a happy editor. So revision. Do what the reviewers ask or have a good explanation for why it's impossible, unreasonable, or not needed. And when two reviewers are agreeing that it's needed, the author's not going to prevail. Okay, so then when we send off to somebody that they need a revision, I also send a section called comments from the editor. That's to make it gentle, but they're not really suggestions; they're commands, which people sometimes don't get, and they're very unhappy when they just are summarily rejected at the next stage. Then they appeal with profound abasement. So the final decision is usually an anticlimax because we've gone through the revision process. The authors have done pretty much what needed to be done, but not always. Leading causes for rejection at that stage, not as opposed to earlier, is declining to revise to meet the reviewer's suggestions, or worse yet, sending a letter saying that you did the revisions, and then when I check the actual manuscript, I find that letter is a lie. You can imagine that we don't publish those papers either. So that's the end of the slideshow. And I'm really on about as I was hoping to be on in terms of time, and I'm at your disposal until the resident conference to answer questions. Sir.
I'm an occasional reviewer for Human Pathology and a few other journals, and I want to ask you a question about your comments about appropriate English, appropriate sentence structure, appropriate punctuation. To what extent do you want the reviewers to be working in this particular area making suggestions?
Well, some reviewers do a very detailed thing. They'll go almost by line and have some very small suggestions. That's more than I would ever ask, much less expect of a reviewer. Reviewers are pretty busy. On the other hand, to say that this Modern Pathology is a truly international journal today. We get a lot of papers from Europe, from China, Japan, saying that it's got a lot of problems with English usage and that needs to be carefully read by somebody who's a native English speaker and corrected. And not everybody who's a native English speaker is a good editor. So that sometimes doesn't get the result that we're looking for. But I think that it needs to be at a decent level. And if the first author, shall we say, is someone who I know has immigrated from another country and English is not their first language, and one of the authors is a native English speaking Ivy League professor, it raises the question, did the Ivy League professor even read the manuscript? Which means that the attestation was false. And I once wrote, I reviewed for American Journal of Surgical Pathology that to Chuck Mills that American Journal of Surgical Pathology should not be having to run a writing clinic for Ivy League medical school unnamed, because I think it's true. But I think it should be mentioned. And again, think of the reader. And one of the problems is our readership is international. And so the worse the English, the harder it is for them to read it. And I'm very strict about reducing or eliminating abbreviations. And one of the reasons for that is we have these international readers and they're struggling along to work their way through the sentences, and then if we aggregate 2 or 3 or 4 words into some acronym and they've got to try to do that with the other half of their brain. And the other thing is that we have a lot of gene symbols in our manuscripts. They're unavoidable, they're critically important, But we already have a lot of these 3- and 4-letter mumbo-jumbo things. If we then take good English words and just arbitrarily glue them together in this, then we double or triple that, and it becomes sort of a alphabet soup. And there's just too many things for people to try to remember while they're working for this. And yes, abbreviations always must have fully spelled out stuff at the first time. But and that's important, it's necessary. But it's delusional to believe that most readers start at the beginning and go to the end. They'll go to where they think they're going to find what they're interested in most. If it's in the results or in the materials or some other section, and it's in the introduction that the bespoke abbreviation is introduced, I mean, they got to then go backwards and search try to find it. I mean, it's just not good. Yes, ma'am.
You commented earlier in your talk about referring to one's own publications. I may have misunderstood you, but the value of that in a balanced way is that one can see the evolution of the work. When I'm reading papers, I look for the author's earlier publications in the bibliography frequently.
No, it's essential to have the relevant ones.
I agree.
But introducing
80% is over the top.
yeah, I got from somebody over the years. I got a jocular, fake author's letter to the editor after like the 4th revision, and in it they say, and the authors suggest a number of additional references by people they obviously greatly admire. One of which seems to be a high school literary magazine article about the history of the Spanish-American War. So we've created a new section in the bibliography called irrelevant references. But the point is that some people do cite an awful lot of stuff that's very tangential. I mean, they're just But no, you need to see that, and you also need. The reviewers need to know that, because they need to say, it's very helpful for them to tell the editor, 90% of what is in this new paper they published in this previous paper. So this is only a 10% incremental improvement, and then that's going to go into the decision process. Is this enough to give it room in the journal? Leo.
Got a few questions. Could you explain a little bit further about how the priorities are done? Is it a numeric? Is it ABC, high, low, medium?
Yes, the high to low with medium in between in terms of the questions to the reviewers. And so when two reviewer and below low is reject. When two reviewers recommend the manuscript as a high priority, that's a really good thing. That paper is highly likely to get put in place into the journal. The problem is that we have a lot of medium priority, and we don't have enough double high to fill the journal. And so where the priority decision really comes to bear is in the mass of ones that are of medium priority. And that's then I take into account things like, is it studying a really, from a population point of view, important disease? Is it, how much novelty does it have? And it's a non-numerical kind of subjective aggregation based on 19 years of experience at this point.
Then a trivial question. Do you have a certain page budget, if you will, per issue? Meaning that it's spread out evenly across the year, or is there a certain annual, more difficult time to get?
Now you're asking for dirty laundry. Well, if you think about the calculation of impact factor, papers that have been around longer are likely to be more cited, because it takes time for the authors of the citing paper to do their project. So it's not uncommon for journals to do what we call front-end loading in January and February. And so we put a bit more of the page budget there if we can. And sometimes if we have a paper that we think will be really highly cited and it was maybe going to slide into December before January, we might hold it over a little longer. I'm not convinced that this has much long-term effect, to tell you the truth, because I'm not sure we're that good at predicting what's going to have a lot of citations. But there is a little bit of that, and it is not even. We try to, but it's not even to the page. But we kind of like to have the actual print issue that's coming into people's offices be about the same subjective thickness. We don't want them to say, gee, this is a really puny issue. Maybe modern pathology is not getting any good manuscripts.
A couple on the sort of integrity side of science and publication. And it deals with novel findings versus reproducing previous findings. This whole brouhaha started a number of years ago with the American Psychological Association, where they, I'm sure you're aware of it, but they put an august group together and found out that 50% of the studies that were being published were not reproducible. And so it was great, you know, people got fired, they got, you know, all sorts of bad things. How has the field grappled with that?
Well, it's hard to grapple with because you don't know whether the fault is with the first person or the group that tries to reproduce it. Could be either way. And I think in our area, there are some of the drug companies have tried to replicate studies and had trouble with that. And they're probably pretty good at doing this and have decent budgets. It is a problem. And I don't think we're really coping with it. We don't really have a way to expand the editorial process to do any sort of additional studies or you know, we try to look to see if, well, we try to have a high standard for not publishing things when we don't have confidence in the authors. I think that's maybe the most effective thing that we can do. If the authors are doing things that cause us to lose confidence, then the probability that their actual scientific work is done correctly is less, I think, and that's a practical thing that we can and are doing. How effective it is not easy to measure, and it's not just in medicine. When I was in a marketing class in business school, some Fortune 500 CEO was quoted as saying that he was convinced that 50% of his advertising budget was wasted, but he just couldn't figure out which 50% it was. Yes, ma'am.
I have a question about review time, and I'd just like your input on this. So, example, as a reviewer, I'll get these emails that say, you have 2 days to tell us whether or not you'll accept or decline reviewing this. And then we want it reviewed within 10 days or 2 weeks. And so, okay, so that's one scenario. The other scenario is I submit a paper and 3 months go by and I never get the review back. And then, you know, I quickly turn it around in a month and then 3 more months go by. And then now what you just said about the holding it over in December, I started thinking,
well,
do that so it'll come out in January. So it's like I got 2 papers coming out in January. For a department, you know, you got to publish X number a year, but if it's taking 6 months till something gets published, it's like, how do you deal with it? It's like all this automatic emails that we get to ask you to review, and you haven't responded yet, and when you're going to review. It's like, are other reviewers getting that for my papers?
Well, I think as far as I know, essentially all of the editorial offices today are taking advantage of this labor-saving automated chaser function. One of the things, though, that can eat up a lot of time is finding 2 reviewers willing to review a paper. And when I go in and I see that we're down to our 12th invitation, I start thinking there's something really wrong with this paper that nobody even wants to touch it. Because they usually, those papers don't end up being acceptable to us. But it does eat up a lot of time, and that's, you know, and I don't know whether we're 2 days or 3 days, but you know, then it goes back into the queue if the 3 days go by. We then have to try to solicit another person. That takes another couple of days, and so we're now basically a week. And if you to work your way down to 10 or 12, and the author never knows that there were these invitations that were rejected.
Well, sometimes you get an email back, or you can look on the
Yep.
website and it'll say it's under a review.
You know,
So it
that
means
means
they found someone.
that means we found people, and then it's got to fit into their schedule. And some people are better about it than others. We track that, but we have a lot of needs, and if we can't just fire everybody who's not optimally prompt, that would that would slow things down, because of the increased workload on the remaining reviewers would slow them down. So we do pay attention to it. I know it appears to authors that we don't pay enough attention, but the truth is we really do care about it. We just don't have with the volunteer system, we don't have a great solution. Yes, ma'am.
Well, to play off her question, I sit on an editorial board, so I'm inviting reviewers, and sometimes you'll get this paper, and the reviewers clearly have missed the boat, and you're, as an expert in the field, you know that this paper's crap, but they've been very polite and not said anything. How does modern pathology handle that?
Well, that's another face of priority. In the end, we have to select among a large number of medium priority, nothing terribly wrong papers that we won't publish. The paper you just described is worse than that by far, and so we basically will just go ahead and reject it. If it's depending on what the reviewer writes. I have the ability to edit reviews, and I can make the review invisible to the author if it's too much gushing. In general, reviewers are asked not to make comments in the comments to authors about the acceptability of papers, and not every reviewer is careful about that. So there will be times when I go in and I redact that. I actually make it vanish. Redacting would be some kind of big black bar, but yes, sir.
So thank you very much for the presentation. It was extremely useful for all of us. But one of the most annoying things is when the paper goes to a couple of reviewers, you receive those suggestions, you make the changes, then it goes back to the reviewers, and the reviewers come with new suggestions, and then you have to deal with those. So this is something that really bothers sometimes the authors, and sometimes they also can find them, or the new suggestions that are coming in that not being quite fair. So how do you actually deal with it?
Well, if the reviewer's request of the authors was for information that was not present in the original manuscript, that would bear heavily on the actual acceptance or not. Basically the reviewer tells me, I can't really judge this because these guys didn't tell me this, or this to help me understand what was going on, or the probability that it's right, or whatever critical factors. Well, then then to get another response is not uncommon, and it could be a negative one. You in poker terms, you show your cards, and the reviewer says, "Oh, this is what I was afraid was happening. This won't do," and that's, I'm sure, very annoying to the author. But it's important to the integrity of the review process. For reviewers who just can't let it go and they keep wanting to fiddle it, that's annoying. But some reviewers, they feel like if they're going to do this review, they need to say something. And if it's to help the author with some unrecognized technical things, then the author should be glad, because their eye didn't pick this up and they can make it a little bit better. If it's just sort of not, then they send me a note saying, well, this doesn't seem very important, or whatever, and I'll take a look at it, and if it's not very important, I'll just go ahead and publish it. But the asking for additional information because you can't even make a preliminary assessment, it doesn't come up all that often. But when it does, it's critically important because you've got to have enough information in the journal, in the manuscript to know what's going on and to be able to assess it, whether you're a reviewer, editor, or a reader.
It's relevant. Usually when you write a paper, there's a lot of things you needed to address or answer. What are, how many key questions you want to be in that paper to be acceptable, to be novel? Like you have maybe just address 2 or 3 novel ideas or something is good enough.
No, it's not like a grant application. Okay, I mean some papers are written to resolve some very narrow and specific but important disagreement among previously published papers, and they've got one question, very narrow, but it's important because on the one hand you've got one paper from a good group, on the other hand you've got another paper from a good group, and it's unresolved controversy. So, and papers do get criticized for being too diffuse, going off in too many different directions or adding on some kind of experiment that really wasn't highly relevant to answering the core question, and just sort of, I don't know, dressing it up a little bit. In the early days of molecular and pathology papers, there was a time of transition when I think some authors felt like they just weren't modern if they couldn't do some kind of little genetic thing in the project, even though in the end it really didn't do much. Today we've gotten maybe a little bit beyond that. One more.
As a reviewer, I usually do some pre-review reading in the topic before I review the paper. Does modern pathology have a mechanism for suggesting what to look at ahead of time for the reviewers?
Well, I think that the eJournal Press software that Springer Nature has does have a kind of connection to PubMed. I haven't used it much, so I can't offer you any evaluation of its effectiveness.
Yeah, okay.
But I think that it's intended to be helpful with that type of inquiry.
But Eble is going to have a tight schedule. After talk to the resident, he's going to fly out to Indianapolis. But he's very acceptable by emails and other things. I think he responds by email himself and schedule everything himself. So, yeah, welcome.
Okay, thank you all.